I'm Golam Khandaker. I'm a professor of psychiatry at the University of Bristol, and I'm also an honorary consultant psychiatrist at the Avon and Wiltshire Mental Health Partnership NHS Trust in Bristol. My research focuses on understanding how our immune system influences risk of psychiatric disorders like depression and schizophrenia. We know these conditions are common and affect a lot of people in their lifetime. There are currently effective treatments such as medications and psychological therapies that help a lot of people, but a substantial proportion of people do not respond to current medications. Our work suggests that inflammation could be a causal mechanism for depression and psychosis. So we are currently pursuing this avenue to test using epidemiological studies, genetic studies, and also proof of concept randomized controlled trials to test, number one, whether there is evidence of a causal role of immunological proteins and pathways in these psychiatric disorders. And number two, to demonstrate whether if we influence activity of these immunological pathways, do we see corresponding improvement in mood, cognition, and behavior in patients with depression and psychosis? Our hope is that our findings would shed lights on new mechanisms for psychiatric disorders in certain individuals and would lead to new personalized treatment options, so expand our repertoire of effective treatment that are available currently. This is a hugely exciting time to join psychiatry as a clinical specialty for a number of reasons. Number one, there is a great need for developing new causal understanding, mechanistic understanding, and new treatments for psychiatric disorders. Number two, we have the benefit of utilizing some of the exciting developments in across different research disciplines, including genetics, neuroimaging, basic neuroscience, and also immunology. And that really sets us up to really drill down into mechanistic pathways, biological, psychological, and social mechanisms contributing to psychiatric disorders, finding new explanations why these conditions emerge in the population, and also finding new ways of helping people with new and effective treatments for these conditions. So currently, this is a very exciting time to join psychiatry as a clinical specialty.